وبركاته. أنا اسمي محمد فاروق، المدير التنفيذي للجمعية الأفريقية لطب نقل الدم Africa Society for Blood Transfusion. ونفس الوقت أنا الخبير الأساسي لمشروع الاتحاد الأوروبي لتطوير نظام الصحة العامة في أوكرانيا. بيشرفني النهاردة أكون مع حضراتكم في المؤتمر العلمي الثاني لجمعية أصدقاء بنوك الدم الخيرية بالمملكة العربية السعودية، اللي بيقام تحت رعاية كريمة من صاحب السمو الملكي الأمير الدكتور فيصل بن مشعل بن سعود بن عبد العزيز. في البداية أحب أشكر اللجنة المنظمة واللجنة العلمية وجميع الإخوة من المملكة اللي تواصلنا كتير قبل المؤتمر علشان نخرج بالأفكار الخاصة بالمواضيع اللي ممكن تتقدم في البرزنتيشنز. وكان بودي أكون معاكم شخصيا، ولكن نتيجة لبعض التداخل في الأنشطة مختلفة ما قدرتش أكون موجود شخصيا، ولكن إن شاء الله عن طريق البرزنتيشن أونلاين نقدر نتواصل ونشارك مع بعض المعلومات الخاصة بأحدث الاتجاهات في طب نقل الدم. إن شاء الله هكون معاكم النهاردة في two presentations. ديت هتكون البرزنتيشن الأولى about standardization in blood transfusion. During this presentation, we will cover in general what are the quality standards, their definition, history, and the development process. And then we will go through the why standards are required in blood transfusion and the scope of standards in blood transfusion and the distinctive nature of blood transfusion system, which makes standardization more important. And then we will cover like the new concept of stepwise approach in standardization. بداية standards they have like many definitions are available. However, the definition here is the one that I really believe represent what is meant by standards. They are documents that provide requirements, specifications, guidelines, or characteristics that must be used consistently to ensure that materials, products, processes, and services are fit for their purpose. The key words in this definition are they are requirements. They need to be used consistently, and the objective is to make sure that whatever we produce, whatever service we are providing, they fit for their purpose. Standards usually they are not static documents. They are developed and then they are reviewed and amended mostly every 2 to 3 years. So it does not mean that we have a set of standards today that we will use them forever, because the technology is evolving, the science is evolving, the knowledge is evolving. So that's why we need to review the standards consistently to make sure that they fit for their purpose. Historically, standards in the field of the healthcare in general started as early as 1917, when the American College of Surgeons established a set of minimum standards for hospitals. Long time later, in 1951, the American College for Surgeons joined with several other professional associations to form the Joint Commission on Accreditation, which we all know as JCI, which represents like the very first real standardization in the healthcare field based on the most advanced knowledge. If we converge to the blood transfusion itself, in 1958, the American Association for Blood Banks, which now is called the Association for the Advancement of Blood and Biotherapies, published its first edition of standards for blood transfusion service. And since then, the American Association for Blood Banks kept reviewing, updating their standards. And in parallel to this, in Europe, many countries started to develop national criteria and standards in the field of the blood transfusion. And finally, with the arrangements of the European Union, Directive 2002/89 which set the standards for quality and safety for collection, testing, processing, and storage and distribution of human blood and blood components, was released in 2002 and became effective in all European countries since then. Also, in parallel to this, many other international and regional and national organizations develop their own standards to use in the blood transfusion field. Later during the presentation, we will see some examples from these standards, and we will discuss which one really we can use in the field of blood transfusion. In general, the development process of quality standards is a quite standardized process itself. So the body that develop the standards can be a government entity. For example, in many countries, it's Ministry of Health. Sometimes it's a professional organization like medical association or nursing council. It can be a kind of international organization like the World Health Organization, or some accreditation organization like the Joint Commission or the AABB. And in many cases, the healthcare facilities themselves, they develop their own standards. For any standard to be to serve their purpose, there are 5 criteria that need to be fulfilled. First, the standard should be realistic, which means, okay, we can write a standard that really very fancy and, like, let's say, state of the art. However, this standard cannot be achieved in any setting unless they have like endless resources. So the first criteria of a standard is to have a realistic standard that can be followed or achieved with reasonable resources. And then second, to be reproducible. So following the standard for a specific intervention results in the same outcome if we keep all other factors equal, and result in the same outcome if we use it in different places, also if we keep all other factors equal. The standard should be valid, so it means it should be based on scientific evidence. It should be clear and understood, so that it is understood in the same way by everyone who may be using it. And of course, finally, it should be measurable. So performance according to this standard can be assessed and quantified, especially if we are doing auditing for accreditation or certification. It's very important to have measurable standards. To just visualize how the process of development of standards is going, the healthcare organization or the blood establishment or the government, whoever the body who will develop the standard, at first they need to identify the need for a standard. They identify that we need to have standards for this process or this activity to make sure the outcomes are fit for their purpose. And once this need is identified, then a standards committee should be assembled to start working on development of this standard. The committee should start with first studying the available knowledge, the evidence, the maybe comparable standards, and do like a preliminary study and gather all required information. And then the committee start to draft the first outline for the standard and put it in text. Once the committee agree on this draft and all of the committee members are in line with the standards, then the standard should be published for public review before being enacted. You may find in some organizations, like if you go to their website, they say, okay, we have the draft of the new edition of our standards for public review. So professionals in the field, stakeholders, any policymakers, they can all check the standard and make sure that it is in line with their interest and in line with the requirement. Once the public review is finished and the feedback from different stakeholders is received and their concerns are addressed, then the standard can be approved officially by the administrative body and then published and enacted to be a requirement for the specific area that was meant for this standard. as you can see, the process is long, lengthy, it needs a lot of resources, and implementing it also will put some implication on the facilities that will implement such kind of standards. Maybe they need to review their process, invest a lot of resources. So why we need to go through all this? I think we all agree that the objective, our objective in the blood transfusion is to ensure safety, availability, and the quality of blood from vein to vein, from the donor to the patient. This is very easy to say, however, it's really very difficult to achieve. And this comes from the fact that the blood transfusion chain is really a complex one. And it involves really a diverse range of activities that sometimes they don't relate to each other. So, for example, there is no relation between recruitment of donor and test and let's say preparation of blood components. So this kind of diversity makes it very difficult to ensure the safety and the quality of blood through all activities in this chain, unless we have what we call according to a defined standard. So when a blood establishment implement standards in their process, first they will ensure consistent practice and high quality outcome across the entire system. And having the standards also will stimulate continuous improvement, will enable blood bank and transfusion service to demonstrate their commitment to quality. It will raise also the community confidence in the service provided by the blood transfusion service, and it will provide opportunity for the blood transfusion service to benchmark with the best. So if 2 or 3 or 4, or let's say 10 organizations are using the same standards, then each one of them will be able to benchmark their performance against each other and also against the best organizations in the field. Using the standards will provide the staff with continuous learning. They will use the standard, they will read them, so they will gain more knowledge, and it will provide them with good working environment. And finally, standardization improve overall professional development of the staff. In the field of the blood transfusion specifically, the scope of standards can be divided into 3 main areas. The first one, the quality system requirement, and the second area, the technical and operational requirements according to the different links in the blood transfusion chain. And then the third one, the requirements if the plasma collected or prepared in this blood establishment will be provided for fractionation. For standards in the quality management area, the standard should cover at least these 12 different areas: the organization and the structure of the blood service or blood establishment, the requirements for the quality management system, the resources, being human resources or financial resources, documents management, documents and record management, supplier and service providers or outsourcing of any activity, incoming inspection and testing of blood and blood components, equipment, how to deal with equipment, safety and risk management, internal and external audits, non-conformances, continual improvement, and process control. For the operational and technical process, it's simply the standards that will cover each link in the blood transfusion chain, starting with the blood donor management, which means donor mobilization and recruitment, and also the activities related to the donor services that we provide to the donor after the donation itself, like the donor like the donor notification and counseling. And then we have standards for the collection of blood from donors, the collection process itself, sterility, how we protect against contamination, the specimen, donor reaction, apheresis, everything related to the collection of blood from blood donors. Handling and transport and storage of blood and blood components, whatever this transportation is after the blood donation and or after the preparation of the blood component and transferring them to the different users and hospitals. testing of donated blood for transfusion transmissible infections, and also red cell serology to test for blood groups, and blood component production and the processing of whole blood into different components, and also the special processing activities like irradiation or washing of red blood cells. Ordering and issuing of blood and blood components, compatibility testing, hemovigilance and the clinical interface, this interface between the blood establishment and the blood user, the hospital, and the blood administration process itself. And if the blood establishment will be providing the plasma for fractionation, then there is a whole set of requirements that should be fulfilled, covering at least these 14 different areas. As we said, many standards are available and are being used by different blood establishment and different healthcare systems. For example, we have the ISO family, especially the ISO 15189, which is generally called the laboratory ISO. We have the JCI standards. We have, as we said, many countries develop their national standards. We have the American Association for Blood Bank, or the Association for Advancement in Blood and Biotherapies, which actually is released or published two kinds of standards, like the full standard of the AABB, and then another set which is called fundamental standards, which ensures the minimum level of blood safety in resources-limited countries. Also, we have regional standards, like from the Africa Society for Blood Transfusion, the AFSPT, or Asian Association for Blood Transfusion, and many other regional organizations. We have some blood establishment using the SLIPTA, which is like the stepwise laboratory improvement program toward accreditation. It's also being used in some developing countries. So as we can see, there are many options that can be used in different blood establishment, but I think not all of them, they will provide the same result. As you can see, in an ideal setting for any blood transfusion system, there should be a legal or statutory basis. And then according to this legal base, there should be an independent national blood regulatory authority or competent authority that's taking care that there is a compliance with regulatory requirements and standards, and that assures quality, safety, and efficacy for all blood products. And under this national regulatory authority, we have the blood supply arm, which is the blood establishments, which do recruitment, collection, processing, testing, and issuing of blood. And we have the blood use arm, which is basically the hospital that are using the blood. So this is in an ideal setting. And if we focus on the operational part of the blood transfusion chain, the blood supply arm and the blood use arm, we will have the full blood transfusion chain that we explained earlier, and we identified that it has many links from the donor to the product to the recipient, and then to manage and check the transfusion outcome. If you look more careful to this process, you will find that it's really very diverse. So, for example, the donor recruitment and donor management, it's kind of public affairs and communication. Blood collection, it's kind of clinical medicine, examining the donor, checking their general health and fitness for donation. And then we have the blood testing, which is laboratory medicine. And then we have the components processing, which is kind of manufacturing, and the blood use, which again, is a kind of clinical medicine. And all these elements are being done under the umbrella of quality management. So you can see the diversity and the different disciplines that are involved in the blood transfusion chain. It's very important to understand that the strength of any chain is equal to the weakest link of the chain. So if we are doing everything in this chain perfectly and at the highest level, but only one step in the chain is weak, then the whole strength, the strength of the whole chain will be as equal to this broken link. That's why when we implement, when we need to when we standardize the blood transfusion process and we use the standards, we need to make sure that whatever we are using, it's covering all links of the blood transfusion chain. So first we need to define our objectives, which is typically ensuring safety, quality, and availability of blood. And then we need to check, are these standards that we will be using, are they fitness for their purpose? Are they enough to cover and to make sure that the blood is safe, of high quality, and available? And we need to also be careful not to waste our resources. So we need to do the right thing right from the first time. I have seen some blood transfusion systems or blood establishment, they start by, let's say, doing standardization or accreditation of the lab. And then they find that it's not enough. This is not ensuring the safety of the blood and the blood components and all elements of the blood transfusion chain. Then they start to find another kind of accreditation or certification or standards for another activity. And this is really wasting of the resources because safety cannot be partial, as we highlighted earlier. If one link only is missing, then the whole thing will be destroyed. For example, we tried to do some comparison between one of the most common and really perfect standards in the field of the laboratory testing, which is ISO 15189, which is used in many blood establishments across the globe. We tried to list on the right side, or on the left side, the blood safety elements or the blood safety requirements, and on the right side, we are listing what is available in the ISO 15189. So, for example, of course, organization and structure is covered in the ISO, quality system is covered. However, resources, they are not covered. The personnel, standards for the personnel working in the blood transfusion field or in the laboratory, it is not covered in the ISO. If we go further, equipment, work environment and safety, internal and external audit, some elements of non-conformances, they are not covered in the ISO 15189. And if we go deeper into the technical and operational activities of the blood transfusion, like the blood donor management, collection of blood from donors, handling, transport, testing, blood components, testing is covered in the ISO, blood component production, compatibility, hemovigilance, blood administration, all these elements are not covered in the ISO 15189. So in spite of the fact that the ISO 15189 is perfect standard for laboratory, but they are not the best way to go if we are dealing with blood transfusion, because we have much more in the blood transfusion chain than the mere laboratory testing. Just some of the different standards used at the EU, whether for quality management system and the inspection, the internal one, or audits by competent authority. The new concept now that is starting to get more popularity is the stepwise approach, because it was found that it may be disappointing to many blood establishments, especially in resources limited countries, that they cannot achieve 100% of the standards at once. So some studies shown that if we recognize quality improvements and adoption of standards at different levels, this will encourage blood services and the blood establishment to further develop themselves and fulfill more requirement of standards. So, for example, at the African Society for Blood Transfusion, we adopted this concept and developed the stepwise accreditation and standards approach, where we have the step one we call it certification, the minimum and basic quality and operational requirements and standards are fulfilled. And step 3, it's when an organization or blood establishment fulfilled the full standard. And in the middle, we have step 2 of certification, which is intermediate between step 1 and step 3. And how we are doing it, if you check this table, on the left side of the table, we have the full standard, okay? And then each standard is either like put in one step to be fulfilled at once, or it was cut into, if it is essential to the minimum safety and quality requirements of the blood. If not, the standard is cut into 3 steps. So, for example, if you check standard 1.1.2, the blood shall be collected from healthy, voluntary, non-remunerated blood donor. So at step 1, we accept that the demography and the epidemiology of the population is checked, and population that are at low risk for transfusion, transmitted infection are identified, and there is a defined facility plan and progress towards collection of 50% of blood from voluntary non-remunerated donors. So if the facility fulfilled this, then they qualify for step 1 certification. To qualify to step 2, there should be a defined facility plan and the steady progress towards 75% collection of blood from voluntary non-remunerated blood donation. And in order to fulfill the whole standard and achieve the step 3, then all donation, 100% should be collected from voluntary non-remunerated donation. So recognizing the difficulty for some establishment in some settings, maybe resources are not available. Maybe they are new and they are still starting to develop their blood service. So recognizing their quality achievements at lower levels will encourage them to continue improvement and learn how to fulfill the higher level of standards. These are the 3 different documents we are using: the standards, the guidance document that tell the organization, provide more explanation about the standards, and the compliance chart that the blood establishments can use to define which step they fulfill. With this, I come to the end of my presentation about standardization in the blood transfusion field. I hope you enjoyed the presentation, and if you have any questions, I will be very happy to answer. Thank you once more for your attention, and looking forward for any question. Thank you.